I'm an emeritus professor of neurosurgery at the Neurological Institute, Phoenix, Arizona. I've been here since 1978, and in 1983 we formed a group now called Brain and Spine, myself and 7 others with leadership of Robert Spetzler. There's a book out that I published as an autobiography, which kind of relates my life. It's called Backbone, and you can get it on Amazon. I lived in a refugee camp for 4 years. Then in 1957, for various reasons, my family immigrated to America. I was 12, and we ended up in Phoenix, Arizona. Then I went to school here, did my residency in Boston under Ben Stein at Tufts. Came back here and specialized in spine starting in the middle 80s. In my residency, it was Ben Stein, Bill Schuchart, Mike Scott, Cal Post, mainly Ben Stein, who was the chief at Tufts. And Bill Schuchart was there, then he went down to downstate. And Mike Scott came on board to my last several years as our pediatric neurosurgeon. About 280 total residents and fellows that I was privileged to educate or help educate and help to mentor. Most of them on academics. I was also very involved in organized neurosurgery at the board level, ABNS, and the residence review level. So and I was on every editorial board known to mankind, which sometimes was a pain, but oftentimes was in education as well. But the other important thing is that I helped put the spine in mainstream of neurosurgery, which it certainly wasn't when I was a resident. Neurosurgery did not do any spine to speak of except an occasional disc in the neck or the low back. And now totally revolutionized neurosurgery with the aggressive treatments of deformity and using minimal invasive techniques, using phenomenal imaging, and then mixing those, the imaging with the robotic minimal invasive techniques. So that's spine is now a very exciting part of neurosurgery, and I was privileged to be part of that. I like the craniovertebral junction, so I would think both anterior and posterior. I did innovative stuff there and published extensively on the craniovertebral junction, fusion, decompression, transoral, etc. So one operation probably is fusion of C1-2. There's wires and screws and rod. That's always a thankful operation. It's one has to be very knowledgeable of the anatomy, obviously, but that's a grateful operation. Well, the go-to is probably the Woodson. We call it the dental tool, or it's a variation of number 4, pencil number 4. I mean, I use that thing to decompress nerve, to free the dura from the lamina, all of those things. So that's one I would not like to not operate with. It's a very simple instrument. Well, I think that the biggest problem I have now, or concern I have now, that we are doing too much instrumentation. It's swung the other way. Patient comes in with low back pain and has a dark disc, and before you know it, he has a interbody fusion and pedicle fixation, or has an anterior approach. And it's just gone too. We have to be much more selective to determine which patients require these operations. The one book that always stands out to me that influenced me as far as preservation, persistence, and to stick in there is The Power of One. The Power of One came out in the late 80s. And it is about an English boy growing up in the Dutch environment in South Africa. And the way he became his own person was that he started boxing, and his best friend was a chicken. And he preserved, because the English were in the minority and were much belittled by the majority of the Dutch people. But he persisted, and it's a phenomenal book. I never forget it. And I would urge everyone to read it. Well, I'm a huge, besides sports, I love all sports, especially soccer. And I've been to 5 World Cups. But the hobby that nobody knows I really is stamp collecting. I have a huge stamp collecting uh, at home, and I got thousands and thousands of stamps. Only collect Germany and USA, and never hinged, usually hinged stamps when you put them in a book, and that devalues the stamp immediately, and they have the mint condition. And I've got quite the collection, and I like. It's probably worthless now because stamps, nobody uses stamps anymore. But I enjoyed, still collecting and finding rare finds. And the one in residency is that they have to believe in the subspecialty that they choose, and they have to fit their personality and character to the subspecialty, which hopefully they'll be exposed to during med school. And I certainly, that was my case when I didn't like pediatrics, I didn't like this and that. And once I did my rotation on neurosurgery, I knew this was me. This was the type of person I would be. Also, like at that time, we didn't have all the fancy MRI scans, etc., and you had to be kind of a detective to determine where the brain tumor was or where the spine problem was. As far as the resident leaving and going out, I think the resident has to decide if he or she wants to go the academic pathway or the non-academic pathway. And then they have to decide where they want to live, and that is influenced by where the parents are, both spouses, if they're married, and both individuals, if they're married or have a significant others, need to like the potential place where that neurosurgical resident decides to go to.